For a man to sleep with his partner and make her pregnant, if she is okay, he needs to have at least 15 million sperms.
In one ejaculation, 15 million
Yes,
sperms.
per meal.
Wow.
Yes. Anything less than that, it may be difficult to just achieve conception. When you say that a couple is having challenges with conception, they think it's always the woman.
Yes.
It's actually not just the woman. Statistically,
Yes.
40% of infertility causes is related to the man.
40%.
40%.
Wow.
Then 40% or so also related to the woman. Then 20% may be a combination of man and woman contributing to the cause of infertility. Going into the future, for instance, more of the causes of infertility may be related to the man than the woman.
Wow.
And we have a projection that if things go unchecked, we may be heading to a time that the race of men like us, as in the genetic men, may be risking extinction, just as we have endangered animal species right now. And this is very, very serious.
Why is that?
Because when you have people coming to do IVF because of gender, most of them are coming because of the male gender. Just in very rare occasions, you have people doing IVF to select the female gender. We may just get to a stage where a man has an empty Y chromosomes, if I have to use that word.
Wow.
And so he may not be able to produce his likes again.
So before we continue the episode, I would like to appeal to you to subscribe to the channel. We want to grow, we want to scale this thing all the way to the moon, and the only way you can help us do that is by hitting that subscribe button. Thank you. Let's get back to the episode. Dr. Kenneth, you're welcome to the show once more.
My pleasure.
Good to have you back.
That's great. Thank you.
The last time was a blast, and I'm so looking forward to our discussion today. Yeah.
That's cool.
So the last time we spoke about assisted reproductive technology, the discussion was more of the woman.
I get that.
So I'm wondering, is there any role a man plays in all of this, and are there any pointers or things for people to look out for?
Yes. Most times, the discussion went that way to kind of agree with what the body language of the world is when you say that a couple is having challenges with conception. They think it's always the woman.
Yes.
But it's actually not just the woman.
Mm-hmm.
It is the woman and the man. And statistically,
yes,
40% of infertility causes is related to the man.
40%.
40%.
Wow.
Then 40% or so also related to the woman. Then 20% may be a combination of man and woman contributing to the cause of infertility. So infertility is actually never complete if you don't talk of the man. And going into the future, for instance, more of the causes of infertility may be related to the man than the woman.
Wow.
And we have a projection that if things go unchecked, we may be heading to a time that the race of men like us, as in the genetic men, may be risking extinction, just as we have endangered animal species right now. And this is very, very serious.
Why is that?
Because the character in the genes of men that makes reproduction of male kids common, and the characteristics of men on the Y chromosomes is gradually chipping off, deleting. And we may just get to a stage where a man has an empty Y chromosomes, if I have to use that word.
Wow.
And so he may not be able to produce his likes again. Yeah, and from our own basic observation, this is not scientific observation now, basic analysis. We observe that a lot of women are being given birth to, females have been given birth to than men.
Yeah.
And when you have people coming to do IVF because of gender, most of them are coming because of the male gender. Just in very rare occasions, you have people doing IVF to select a female gender. Even though this gender selection, it's not encouraged or practiced in a lot of places in the world for political reasons or sensitivity. You're trying not to be too sensitive to a gender, but the
Yeah.
reality is this: we that are on ground and are in the field see what the demands are. A lot of people come and say they want boys. They want boys. In fact, I have somebody before who had told me that he wants more than one boy. And in his own words, I am too wealthy that only one son cannot manage my wealth.
Wow.
And so a lot of people, these are the realities. The books may not agree with this. Yeah, the books may not agree with this. And politicians or the political scientific community may not also agree with it. But the reality is that there is a lot of biases we see for those of us who are in direct contact with the populace with respect to gender desires. Okay. So, but then going back to infertility, 40% or more is related to the males. And when the sperms are low,
Yeah.
it may be a reason for an assisted reproduction technology, IVF. And if you look at it, I talked about the extinction of males, which is a possibility in the future. And by the way, I'm not the one formulating this.
So this
Yes, this
information
is
that's out there.
information that is out there
Yeah.
from scientists who have spent time studying the male gender and the characteristics represented on the Y chromosomes of men.
Yeah.
So we're hoping that things will be put in place to check them. And I guess we'll talk about that in a little bit. Yeah, so male infertility is huge, very huge. Previously, like 20, 25, 30 years ago, the sperms that is considered as normal should have a count of over 20 million.
Okay.
It got to a point that we're talking about 20 million to be normal.
That's for every ejaculation.
Ejaculation, yeah.
Okay.
Yes, 20 million per meal of the ejaculates normal. But now we are down to 15 million. So you see, the number that is classified as normal is gradually becoming lower and lower and lower. And maybe later we'll say 10 million is normal. But I don't know where this is taking us to. But this is just all a show that something is going wrong with the males, with the sperms of males. And a lot of practice may be responsible for this. So when sperms are low and are very low, or when they are not even available in the ejaculate, IVF or assisted reproduction technology is the way to go if they must achieve pregnancy. So yes.
So what causes a low sperm count? Is it just age, or are there genetic?
I want to start with
issues?
age.
Okay.
Yeah. It's not a common observation that people in the regular biology society make. But yes, I want to start with age.
Okay.
With the understanding that we have right now in male reproduction, aging is associated with sperm's abnormalities and generally, and that is in respect to the quality, the count, the function of the sperms, and the ability of the sperms to produce healthy babies. So as men are aging,
Yeah.
the quality of the sperms and the function of the sperms are reducing, depleting, and all of that. So it becomes difficult to achieve pregnancy with those sperms. Then miscarriages are higher because of advanced aging of men. Then abnormal babies are also higher when conception happens with very old men. So it's not just women that age affect, it also affects men. But just that no matter how old a man is, his body still keeps producing sperms. But then the quality of the sperms are lower,
Okay.
and the count may also be lower. So age affects it.
So abnormal babies, such like babies born with deformities, or
Yes.
okay,
Either structural deformities or functional deformities.
okay,
Functional deformities could be things like autism.
mm.
Yes. And if you look at the society now, I mean, when we were a lot younger, maybe knowledge wasn't much. It was like the word autism was not in existence. Yes.
All right,
When we were younger.
yes,
But it could just be because the knowledge wasn't really available. But now, even little kids know about autism.
yeah,
You hear that say this child is autistic, this child is autistic, this one is autistic. It's not a discrimination against autism, but there's a lot of things responsible for autism. And the age of a man at conception, advancing age, is one of the factors. The consumption of plastic materials.
plastic material.
Yes,
So you mean
plastic.
people eat plastics? Or-
Yes, people eat plastics.
wow. Okay.
Indirectly, yes, they do eat
Alright.
plastics. You know, when you eat food in plastic wares, for instance, you consume the plastics. When you use your microwave food in plastics bowls, you eat plastic. You know, when you drink in plastic, you consume plastic. When you eat fish in the rivers, I mean, gotten from the ocean that have been polluted with plastics, you also eat plastics. I know these plastics are not degraded by the body.
Wow.
You know, so they compromise the health of the hormones in the body and affect the sperms, they affect the eggs, they affect the babies that you conceive. You know, and that is why you see that in advanced society, for instance, plastics have been restricted. You know, if you're in the United States, for instance, or in England, and you go to shop and you're requesting for a plastic bag, they charge you a penalty for the plastic. And these are all moves to discourage people from the use of plastics. You understand? Wow. Yes. You wonder why the European society would keep a huge vessel on the waters with all kinds of rigs packing plastic from the bed of the ocean and all. You think they don't know what they're doing? There's a lot of work done about plastics. It affects the health of sperms, affects eggs, affects babies, affects life, affects the hormone of an individual altogether.
Sorry, let me take you back a little.
Oh, yeah.
If I drink water from a plastic container,
yes,
part of that plastic is getting into me.
Yeah, when the plastic is, there are different kinds of plastics, by the way.
All right.
You know, now, and there are ways that these plastics should be handled. Some of the plastics are safe if you drink water in them without warming the water in them.
Okay.
But when you heat the water in them, part of the plastics chips into the water.
I see a lot of shops and stores put out plastic water under the sun.
Exactly. That's completely unhealthy.
Wow.
It's a pollution of the society you're watching. You know, standard, this should be kept under the shade. Not just plastic, not just water now, even the soft drinks you consume, you know. So yeah, that's it. I was in Hilton in Nairobi, 2022, just before the Russian invasion of Ukraine. I was following the events, hoping the world doesn't shut down from there. So I was in the gym, you know, in Hilton in Nairobi, and I saw a big inscription on the wall. Sorry, we do not serve water in plastics. We have, however, made provision of glasswares and water dispensers. So kindly make use of them, but be careful so the glass doesn't cause injury. When I saw that, I stopped and watched. And I was happy that Africans are already thinking in that dimension.
Yeah.
Okay, so the glasswares are made of earthen products, sand and all of that, you know. So they are not chemicals that cause pollutions.
Yeah.
You understand? So it's safer with the glasswares and the ceramics, you know. So that is what plastic is. But it's very difficult to preach about this and get people to understand and begin to practice them. And it's difficult to run away from all of it because most fast food joints in Africa, in Nigeria, for instance, use these plastics. And when you get these foods, they microwave the food in the plastics for you.
Wow.
So these are gradual poisoning. They affect the sperms, they affect humans, they affect babies, they affect health, they affect your hormone system generally. So in India, for instance, if you buy plastic polythene bags at shopping, you pay penalties. At least where I lived in India,
Yeah.
Do that. And then if you see a lot of eateries in the Western world don't use plastic, they use paper
Paper
plates.
bags. Yeah, paper plates. Yeah.
It's just for not. They're not just using it because they intend to use it. It's because of for health reasons and safety. And you see, if you come down to our generation, our parents, at least we grew up seeing that they prepare their food in clay pots. Drank water from clay pots. At least I saw that myself. Clay pots. And you wonder why they were having babies to very advanced age, why they were healthy to very advanced age, is because of less interference with pollutants.
Yeah.
In fact, sometimes their foods are served in leaves. Is it banana leaves now or something? I'm not very sure. But this kind of leaves that are wide, they serve food. So it's a natural way of living. So yes, plastics affect, and that is how we consume them. Then for those who eat a lot of fish, for instance, this fish eats the plastics. And that's why these plastics have been taken out of the water bodies. So aquatic life don't contaminate themselves and indirectly contaminate humans. So these affect reproduction, they affect sperms.
Wow.
Oh yeah, those are the ways we consume them.
So before we continue the episode, I would like to appeal to you to subscribe to the channel. We want to grow, we want to scale this thing all the way to the moon, and the only way you can help us do that is by hitting that subscribe button. Thank you. Let's get back to the episode. At what age do you think a man's sperm cells are most active?
Before 35.
Before 35.
Yes, before 35, the sperm cells are. This is not to say that men don't have problems before 35.
Okay.
But when it gets to age,
Yes.
all things being equal, with respect to age, the sperms are most active before 35. In fact, we have a the dimension the world is going right now. It's when men are getting to 35 and above,
Yeah.
and are not yet having kids,
Yeah.
they may be considering freezing their sperms.
So we can freeze sperms as well as eggs.
Yes,
Okay.
you freeze sperms. You freeze sperms. And there are a lot of reasons why men will freeze sperm. But by the way, I'll come back to this. So men have a lot of reasons why their sperms are low. Sometimes it could be infection. Infection can take care of the sperms and damage the sperms. All the sexually transmitted infections.
Yeah.
Sometimes it could be trauma. Recurrent trauma to the testes can damage sperm producing cells right there and affects the ability of a man to produce, to ejaculate sperms.
So when you say trauma, I'm just thinking of psychological trauma, but
Physical trauma.
Okay.
Physical trauma, like there are some games that you risk being hit at the balls.
Yes.
I don't know which game I want to mention right now. I'm common among sportsmen.
Even soccer.
Even soccer,
Yeah,
exactly.
yeah.
So traumas like that. Or sometimes accidents,
Yes.
they could cause problems. The infection, traumas, and some disease condition like diabetes. Even if you're 20 and you have poorly treated diabetes, you have problems with the sperms. If you have thyroid abnormalities, for instance, this goiter problem, thyroid abnormalities, like hyperthyroidism or hypothyroidism, these can affect the sperms and affect the health of sperms. So now, for some reasons, a lot of inflammation can happen around the testes and the epididymis. These are structures that produce and store the sperms, and then they are not able to produce the sperms or store the sperms properly. And then the quantity of sperms that a man ejaculates may not be high enough and good enough to make a woman pregnant. They may be requiring IVF. Because with IVF, even if it is one sperm, you can take the one sperm and inject directly into an egg. a procedure we call ICSI. Women call it ICSI.
Okay.
Called ICSI, intracytoplasmic sperm injection. Even if it is 2 sperms, you're able to get healthy 2 sperms. You could get them, inject 2 eggs, and then the couples can get pregnant by that. So when men have low sperm counts, IVF is what needs to be done, assisted reproduction technology. For a man to sleep with his partner and make her pregnant, if she is okay, he needs to have at least 15 million sperms.
In one ejaculation, 15 million
Yes,
sperms.
per meal.
Wow.
Yes. Anything less than that, it may be difficult to just achieve conception. But you could achieve conception with something less than that. It is not going to be guaranteed that it could just happen easily if the woman is just okay.
We were taught in biology that the sperms need to swim
Sure.
to get to the egg.
Yeah.
Is that the reason it needs to be plenty? Why that number if one can just get her pregnant?
Okay, yeah. If they are low in number, whatever is making them low in number may be affecting their quality and function. And that is why they may not be able to make a woman pregnant.
Oh, okay.
But even if it's 15 million, it's just one that makes a woman pregnant. But for you to have 15 million, it means that you have good enough sperms to a large extent. But you could have also 15 million or even 20 million. They are all not moving
at all.
Yeah. They're all static and are not moving. It means there's a problem. You're dealing with a problem on having such kind of abnormal sperm. So they can still not make a woman pregnant. So you have to examine them and see what their capacities are. You may need to do an IVF in that case. But the first point is always to try to understand what the problem is in case the problems can be amenable to treatment. So if you do that and you still cannot correct and start making them move actively by giving medication or doing surgical procedure to correct them, then you will need to consider an IVF. And then if it doesn't work, then you may need to also consider the prospect of sperm donation. Sperm donation comes in when people don't have good sperms or when they don't have sperms at all.
Yeah.
So people can get to a point where they don't have sperms. It all depends on their health condition. Yeah, the world of sperm is actually very, very, very huge. And when I start talking about them, I have what we call like a thought insertion in psychiatry. A lot of information start jamming my head because I've read so much about sperm, worked a lot on sperms, and I feel like saying all of it at once. And at the end, I get confused.
Okay.
You understand? So when the sperms are low, you do IVF with intracytoplasmic sperm injection. Sometimes it could be genetic problems. If a father has abnormality with sperms, his kids may also have abnormality with sperms.
Oh, wow.
Yes, because I've seen families, for instance, where all the boys have sperm abnormalities and they couldn't make their wives pregnant. I've seen them. 3 all in a row.
3 generations? Or?
No, 3 kids in the same family.
From the same family.
Couldn't make their wives pregnant, and all because of problems with sperm. Not because they've done anything crazy in life.
And that couldn't be coincidence.
No, it's not coincidence. It's genetic.
Wow.
And because when a father has genetic abnormalities leading to sperm problems, the kids, the males, may likely have that. So sometimes you may have to cut into the testes surgically to extract sperms. So you could make a woman pregnant by IVF too.
Okay.
Yes. Sometimes when men have hernia, for instance,
Yeah.
inguinoscrotal hernia,
Yeah.
they could have problems with the sperms.
Wow.
Because it accumulates a lot of fluid or substance around the gut in the scrotum and heats up the sperms and then can damage the sperms.
What causes hernia?
It's birth defect often.
Okay.
Birth defect if the anatomy around the body cavity is not well aligned or sealed when the child is being formed or growing and all of that, some part of the intestines can just push through those defects. They are like holes leading to some other places.
Like a weakness.
Exactly. It's a weakness. Yeah. Anatomical weakness of some structures. Yeah. In the body. So that is these are all things that can happen to sperms of men.
So, in your experience, apart from a plastic injection into the body and trauma, what other practice do you think is could be attributed to a low sperm count or a defect of sperm cells?
Yeah, consumption of recreational drugs.
Recreational drugs.
Yes. Yeah, and it's common among sportsmen.
Okay.
Consumption of steroids, smoking, alcohol consumption.
Yeah.
Are all things that can affect sperms. And more contemporary now, the use of gadgets.
Oh,
yes, like
phones,
laptops, phone more than laptops. The phones. I don't know if phone gets hot. Mine doesn't get hot.
Yeah, it does. It gets hot.
Okay. So now, in addition to that, they keep a lot of radiations around them.
Wow.
A lot of radiations around them. I know when guys hold on to their phones are always around their genitals.
Yes, especially in the pocket.
In the pocket.
Yes.
And a lot of crazy guys don't just have one. Some have 3.
Yes.
And they carry the 3 phones everywhere they're going.
Wow.
So you can imagine you're not just being affected by one phone, but 3 phones. I'm not just saying this because I intend to say it. There are studies that have been done on men carrying phones in their pockets and those not carrying phones. The sperms of those with the phone in the pocket was poorer and less capacity to bring about pregnancy as compared to those who don't carry phone. So phone affects the sperms. And this is a lifestyle that we're all exposed to. You have your phone and have my phone, but the question is, how do we preserve the phone? Now, it doesn't mean that everybody who carry phones in the pocket will get sick.
Okay.
When your sperms are not healthy, you're sick.
Yeah.
So it doesn't mean anybody who has phone in the pocket is going to have problem. No, it doesn't necessarily mean that. But it affects the sperms. The radiation affects the quality of sperms. Yes, and it can make a man incapable of achieving pregnancy. My worry is not even men carrying the phones now. It's the generation of boys, young boys, little kids that use their parents' phone when connected to signals.
Yes.
I know if you watch these boys carrying the phone, the first thing they do is they put the phone just close to their gonads.
Yes.
To the testicles.
So even at that age.
Oh yes.
Wow.
It begins to damage stuff around there. Because the phone has a lot of radiations. And it's the radiation that does the damage. And most times it's just around here.
So would you say phone radiation would affect more of sperms alone, or there are other complications that could come as a result of the radiation?
It affects babies that are in the uterus.
Okay, so even women who are pregnant,
who tie phones around their abdomen, yes, affects the quality of the babies. Affect the babies.
So the baby could come out with some defects.
Oh well, I don't have that information to say defect, but it reduces the quality of babies.
Okay,
you understand? Then even those making the phone call on the brain in the head, for more than 6 minutes, it's damaged the brain cells.
For more than 6 minutes.
Yes.
Sometimes I go 2 hours.
Exactly. It damage the brain cells.
Wow.
If you keep it on the breast, for instance, it damages the breast tissues.
Wow.
So that's just the side effect of this advancing technology, okay? So the advice is, in as much as it's okay to use them, keep using them, but keep them away when they are not they're not necessary. Then if you have other devices that can keep the phone away a little bit far off and allow you to keep communications going, you just do that.
How about stuff like a Bluetooth?
These are advised.
Okay.
Yeah, they're advised. Less damage come with those.
Okay.
So those are the problems with phones. So they affect sperms. So just because you ask, these are all the things that affect sperm. Then the kind of medications that men consume. Drugs for hypertension, treatment of hypertension, affect sperms. Some. So for us, for instance, in the facility where I work, APS Hospitals and Diagnostics, our sensitivity to reproduction is just top-notch. And sometimes the cardiologists don't understand how we operate.
Okay. How so?
Just because when men are advanced, their BP is high. Often,
Yes.
BP
Yes.
is an aging problem for
Yes.
95% of people.
Yeah.
So, and that's to say that as men are aging or women are aging or humans are aging, chances are high that they will have hypertension.
And it's even, I think it's below 95 now because more young people are coming down
Exactly.
with, yeah.
Just right now, I just left the organization where I work, just seeing a young boy with severe hypertension. A young boy with severe hypertension. I was interested in it because, come on, man. So lifestyle has changed. Stress is much and all of that. So stress and aging have something in common, and hypertension comes in between them often. So yes, so I tell the cardiologist, this your patient needs his medication changed because we want to give them the best chance to achieve pregnancy. And the cardiologist go, these doctors from Alps now are too much. Yes, they're paying heavy for the treatment.
Yes.
And these medications sometimes do not allow sperms to operate optimally. Now, in case there are doctors who are listening to this podcast, medications like the angiotensin converting enzymes,
Okay.
converting enzymes, it's a class of drugs that is in vogue right now for treatment of hypertension with less side effect. It gives you good result with BP treatment, but it affects the sperms.
Wow.
The diuretics, for instance, which is the first choice of drugs for blacks with hypertension, affects the sperms negatively. Now, it doesn't mean they can't achieve pregnancy when they are on those drugs, but you want to improve their chance of getting pregnant. So in ARPS hospitals, for instance, we would request that all of those drugs that are not healthy with respect to conceptions are changed and give you time to have a washout
Yeah.
of those chemicals from your body and place you on drugs that are friendly with reproduction before we go ahead with your treatment of reproduction.
Wow.
That's why. So you see, drugs affect sperms. Drugs. And I think doctors should take time to look at all of those things. So drugs affect it. Just drugs affect it. So gadgets, phones affect, drugs affect, age affects a lot. You see foods in every, with all kinds of modifications from the natural states that they are in. So some of them have fat, saturated fat, trans fat, and all of those.
Yeah.
They affect health generally, and by extrapolation, will and affect reproduction for men and even women. So food does a whole lot. But then if you ask me which food is safe, I'll say food in the natural state and a lot of green vegetables
Yeah.
are very advisable
Okay.
when you get to do reproduction.
Yeah. I was going to ask you if a man is diagnosed with low sperm count and wants to rejuvenate, are there practices or medications or anything that could help?
I think the bottom line is, first of all, you look out for what is responsible for the low sperm count.
Okay.
That's what we do in Alps where I work. It's not enough to find out that a man has low sperm count. You want to find out why he has low sperm count. Was it that he had a surgical procedure before, and the pipelines along the sperm the sperm house are cut off or blocked by inflammation?
Yeah.
Or is it that he has infections before? Or is it that it's a genetic problem? So you first of all seek to understand why he has a low sperm count. Then the correction will now be based on what you find. If it's diabetes, for instance, because diabetes is very notorious.
Yeah.
It doesn't just affect the eye and the brain and the heart and the blood vessel. It affects the sperms.
Wow.
And damage the sperms.
That's quite deep.
Yeah, it damages the sperms.
Yeah.
So you correct. If it's diabetes, you correct it. If it's thyroid abnormalities, you correct them. If it's infection, you treat. Then, of course, you place them on multivitamins that could help with sperms or antibiotics. and hope it gets improved. And sometimes the damage to the sperm will be so bad that they are irreversible, in which case you just make do with whatever you have. And if at the end of the day there are no sperms, then option of using a donated sperm, and it's a practice that is done everywhere in the world, can be utilized.
Does prostate cancer or prostate enlargement, does it affect quality of sperm as well?
Prostate cancer, yes, can affect the quality of sperms. Enlargement of prostate, which is benign prostatic hyperplasia, may not affect. But because it is associated with aging,
Yeah.
the whole situation can affect the quality and the volume, the number and the health of sperms.
Yeah.
Because that enlargement of prostate begins to happen anywhere after 40 years for men.
So unlike the women who are born with a specific number of eggs.
Oh yeah.
I know men are not born with a specific number of sperm,
Yeah.
right? It's something that they produce.
Oh yeah.
Right, so we produce
Exactly.
sperms.
We produce sperms.
I think daily or
yeah, daily.
okay.
Daily.
Yes.
Yeah,
So
yeah. But then the cycle of sperm production, I think, is about 84 to 90 days.
84 to 90 days.
Yes. But then this happens daily.
Okay.
And then when you're treating a man with sperms, for instance, you give him the grace of 90 days. Because that's what it takes, like a cycle of sperm production to be complete. So that's it. And by the way, while evaluating them, if the problems that is causing the sperm abnormality is surgical, like you have abnormal blood vessels on the testes, or you have hernia, or hernia that's around the testes, then you have a hydrocele all around the testes.
Yeah.
Correct. And sometimes you want to be sure whether the testis is in the right place. Yeah. There was a time there's this a video on Facebook I saw. A small boy, like around 4 to 5 years, with some fallen teeth. He came talking to his dad, and he was speaking. He said, Daddy, it's not there. It's not there. I said, what are you talking about? He said, it's not there. It's not there. What do you mean? He said, the balls are not there. Not there. And the father couldn't just understand what the little boy was saying. He said, go and check. It's there. And the boy was just crying. Then the father asked him to try to explain. He said, don't you know? The balls. When I saw the video, I laughed. I said, what is this boy really trying to say?
Yeah.
Little kids have times where their testicles retract.
Okay.
And so you feel the scrotal sac and you don't feel the testicles.
Yeah.
So maybe his father was a doctor. And that sometimes I decide to just go bath my son.
Yes.
And whenever I'm bathing him, I just feel the I hope he doesn't watch this podcast. I just feel his testicles. And then it tickles him. And he doesn't know why I'm doing all of that. Just for me to be sure that the testes are in the right place. Because if they are not in the scrotal sac, and by the way, this should be done on the day a male child is born.
On the day or?
Yeah.
Okay, every day or on the day?
The day he was born.
Okay, the day he was born.
It should be checked by the team of doctors or healthcare practitioners who delivered the baby to be sure that there are testes. Because sometimes these testes are hanging in the abdomen. And then if they are neglected, they will die in the abdomen.
Oh, wow.
And so you have a child growing up without ability to produce sperms. But if you find out early, you could do all the surgical procedure to pull them down to the scrotal sac.
How long do you think they can survive in the abdomen?
This information may not be very right now, but not more than 10 years.
Okay.
And most times when guys caught this abnormality, they're already in their adulthood. And so they're already dead. And now what you're even worried about is maybe they hope they don't transform to cancers, to some form of cancer. So then when you go correcting it, it's just to take it out because they are dead already. And you're hoping that you're preventing cancer from developing from that abnormal position, because the abdomen, the body heats them up. The
Yeah.
testes are hanging down because nature wants them to be cooler, 5 degrees cooler than the regular body. So whatever makes them hot, like hernia,
Yes.
hydrocele, all of that kills the sperms.
Wow.
And to a large extent, it can also kill the testes.
Hmm.
So you look for what the cause of the abnormality is, fix the abnormality. So usually when doctors see some patients and the sperms are low, they just go loading with multivitamins. No. First of all, you have to understand what the problems is. Some of the problems will be corrected by surgery.
Okay.
Some by treating infections. Some medications. And some may not be correctable. Then you advise them to take donated sperms.
At what age do you think a man will stop producing sperm, like a healthy man?
There's no age.
Okay, so someone at 90
Can
can
still
still
produce sperm.
impregnate a woman.
Yeah, but the chances are going to be very
Very,
low.
okay.
And then the chances of having abnormal babies is higher
Yeah.
at that point. And the chances of having his female partner having miscarriages are going to be high, because a lot of miscarriages in our current time as a result of poor sperms. And the older a man gets, the poorer the sperms become. So you could produce sperm up to that age. The question is whether you will have energy to have intercourse to make a woman pregnant, or the sperms will be retrieved by some interesting means to make someone pregnant.
You mentioned hydrocele.
Yeah.
What is it and what causes it?
Hydro means water.
Okay.
So now there could be some strange connection between the fluid in the body and the testis,
Yeah.
or the scrotal sac. And this water follows a sac and stays around the testis because of defects, anatomical defects in the orifices that is connected to the testis and the abdomen. So you have water leaking into those places. And then that's where you see men with very huge testes.
Oh,
Sometimes they walk with their legs wide open.
okay.
You see a lot of them in villages in Africa,
Yes.
you know. But these are just very minor things that could be corrected. But because
we
they are
call it
neglected.
juju.
But because they are neglected, the man goes that way. And if you are not too lucky, it damages the entire testicles or the sperms. So if a man has that, it should be corrected before reproduction is considered.
When it comes to anatomical defects,
Yeah.
could it be inherited, or is it as a result of trauma as well?
One, it usually is a birth defect.
Okay.
I mean, there are abnormalities that form when a child is trying to be formed, you know, and then some problem with those body structures just develop. And what we know in medicine now, everything seems to be genetic. So yes, it could be inherited. But yeah, science, we're waiting for when those in that field will link it up to genetics. But from my own perspective of medicine, every character you see in an individual is genetically determined.
So
Every character.
if a man is born with some birth defect, so let's say he doesn't have a limb or a leg or has some form of defect, just to put generally, are there chances that he might give birth to children of that same, or is it?
It's possible. It all depends. If that abnormality is represented in the genes, then it could pass it on.
Okay.
Yeah. Sometimes those abnormalities are associated with the kind of drugs that the parent consume during the conception of the child, especially those limb deformities or absent limbs and all of that. There are drugs that are notorious for that. Okay? So in that case, it may not be transferable.
Okay.
Yes, but some may be genetic, and then they can't be pushed to the next generation.
I was going to ask you something when you mentioned drugs, drug use. You know, men have enhancement drugs that they take, both the ones they buy in the chemist, the pharmacy, or the traditional one, to kind of boost them and make them perform very, very well. What do you think in relation to what we're talking about, the quality of sperm and performance? Does it affect that in any way in your experience?
I don't know so much about these drugs. So it's going to be very difficult for me to say whether it will affect sperms. But if the components of those drugs are dangerous to the cells, it could affect sperms. The few I know, for instance, are naturally derived products. And those naturally derived products do not affect the human system negatively. So they will not affect sperms. They won't affect sperms. And even the ones usually made traditionally and all of that, they are all derived from
herbs
from nature. So things from nature are usually safer. The only challenge is the dosing. If it's abnormally dosed, then you could be dealing with some problems later, like the kidney problem, because most of these things are cleared from the system through the kidneys.
Yeah.
Then the liver. So you could have some other problem. But if taken in the right quantity or right dose, no problems. And then most of them increase blood supply to some parts of the body, especially to the penis and all of that. And they may have side effects. And so you'll be very careful who consumes it. Those with cardiovascular instability should be worried about consuming some of this medication. So at best, it should be taken under the guide of some medical experts.
Yeah. So there's this test that is done before marriage, and churches, religious organizations make people, run those tests.
Let me see whether I did some of those tests.
Why I'm saying this is, we were always asked to check for genotype.
Oh, sure.
Then HIV status. What else? I think basically these two, they're like the twins that go hand in hand. But I was talking with a pastor, and he said these days they're asking couples to go do fertility test.
Yeah.
Right. And I asked what that meant, because to me, in my naive whatever, a fertility test would be the couples trying it out to see if yeah.
Sometimes that makes sense anyway. Oh yeah, that's actually, there are some culture in Nigeria that you have to try it out and see whether you can get the woman pregnant before you get married to her.
Yes.
So I really I don't know, but it depends on the culture, tradition of the people, and the religion. I think they should handle it accordingly. But now genotype, it's okay to do genotype, because we've been advising that people should make the right choices based on genotype.
Yeah.
So that you don't have genotype mismatch. Because if you have a genotype mismatch, like an AS marrying an AS, you could have an SS baby. So the church is advised to, not just the church, the mosques, the temples, the shrine temples and all of that. They should guide the people right, because this is totally out of religious domain.
I don't see how the shrine is going to guide people anyway.
They need to know it.
They will have to come up with their own technology.
They just tell them to go to the lab.
Okay.
A native doctor has referred a patient to me before.
Wow.
I'm telling you the
truth.
Tell
me about it.
A native doctor.
Okay.
I was just there. It was a normal consulting there, and had a phone call, an unregistered number. I picked it, and it was in Hausa. I was like, all the way from Kano.
Wow.
Kano, Nigeria,
Wow.
And then he spoke in Hausa. He introduced himself as a native doctor.
Wow.
And that he has been trying to make this couple pregnant, and the couples aren't getting pregnant. But he has heard about me, that I'm a reproductive biologist and IVF specialist and all of that. So he wants me to try and see if I can make them pregnant.
Wow.
For once, I laughed because it came across as being funny to me. Yeah. And the native doctor was laughing too.
He probably have taken their money in the in the hope that to get
He
them
told me he has
pregnant.
been doing that and people have been getting pregnant. But this case has
It's
defied all.
notorious. Okay.
So yes, they need to know that because these errors come from all these places. Not everybody is privileged to be in a civilized setting where the right testings will be
Yes,
done.
yes.
So all religion and all faiths should be encouraged to do the genotype, especially if they are in the sub-Saharan Africa, the Mediterranean, and in India, for instance.
Yeah.
Because when they find out what their genotype is, they should be guided aright. But they shouldn't be disqualified from getting married, even if the genotype is not matching. They should just be advised on the right way to go about getting pregnant.
Wow.
Because they can actually have healthy babies, but they have to do the right thing.
That's
Pregnancy shouldn't just be unplanned.
yeah.
And the planning should be assisted reproduction technology, pre-implantation genetic diagnosis with IVF.
Wow.
Just recently, a couple canceled their marriage, and it was on social media everywhere because of genotype mismatch. And a long message was sent on Facebook and on a lot of social media blogging sites. So we made a huge talk about that, and advise people on how to go about it. This is not the kind of marriage that people who don't have money should get into because it's very expensive. So you can have healthy babies doing IVF with pre-implantation genetic diagnosis, or one of the couples may decide to opt for a donor gametes from someone who is AA. In that case, the babies cannot be SS. Otherwise, bringing SS babies to the world is a big wala, and it shouldn't be encouraged.